Hello, everybody. This is Carrie McKinnon at Solvang Library, part of the Goleta and San Ynez Valley Libraries. And we have a wonderful program for you today. Everything you wanted to know about dementia, but were afraid to ask, with Lauren Mahakian. And Lauren is volunteering her time to talk to us today. We're super grateful. Coming to grips with signs of memory loss in ourselves or a loved one can be very difficult. And as Lauren has said, sometimes love is not enough. You need information. Lauren has been helping families navigate this process since 2008. She's a certified dementia practitioner, a validation practitioner, care manager, and a gerontology specialist. She works with families and individuals that are affected by Alzheimer's, dementia, Parkinson's, and other cognitive disorders. Lauren is the author of the Stimuli Activities Program for dementia patients and the founder and president of Family Connect Memory Care, owning and operating 3 memory care homes in Torrance, and in the next few weeks, opening a 6-resident home in Solvang. Lauren's a speaker, a trainer, an educator, facilitator for the Alzheimer's Association of Los Angeles. She facilitates virtual and in-person support groups for caregivers, and she offers the Unlocking the Doors of Dementia with Lauren podcast. And some of you may have seen her brain health column in the San Ynez Valley News. So her website is familyconnectmemorycare.com. You can get more information there. And right now I want to welcome you, Lauren. Thank you so much for joining us today.
Well, thank you, Carrie. It's wonderful to be here this morning. Okay, so welcome. Everything you wanted to know about dementia, but you were afraid to ask. Well, here you can ask. Okay. So let's just talk a little bit about memory and aging. Of course, as we age, there are subtle changes in our memory. So what's normal? Maybe little things that really don't interfere with our daily activities or our quality of life. For example, misplacing our keys, or let's say running into someone that you haven't seen in a while and you just can't recall their name, but maybe 10 or 15 minutes later, it comes back to you. Okay. That's not dementia. That's just part of, the normal aging process. What's not so normal is when daily active living activities start to become very difficult for us. So for example, self-care, not showering, not being able to manage our finances, balance our checkbook, miss paying bills, forgetting appointments, forgetting to take medications. This is not normal, okay? So let's talk about dementia textbook definition. Memory impairment, dementia. One or more cognitive difficulties, such as language difficulties, aphasia, difficulty finding the right word, failure to recognize objects, like mistaking the remote for the telephone, just disturbances in intellectual functioning. Okay, that's textbook definition. Now I'm going to give you the definition of dementia according to Lauren. Dementia is a shift in the way a person experiences the world around him or her. It's just a shift. This should connect us, not separate us. And I'll circle back to these, okay? It helps keep our focus on the whole person, not the disease. And so what happens is when our loved one is given the diagnosis of dementia, everybody's focusing on the disease, not the person. Dementia is a change in the person's ability. A person with dementia still has a sense of purpose. We need to support a person's living with dementia, and we need to change our approach. So that's my definition, and how I have implemented my programs in my memory care homes, and also working with individual families whose loved ones have dementia or Alzheimer's. Okay, so I kind of want to circle back to the connecting part. It's very normal for some family members to kind of start to separate from their loved one who's been diagnosed. Fear, not understanding the disease, not understanding how to communicate with them. And what happens there is separation as opposed to connecting. And hopefully you will learn at the end of this presentation how to connect with your loved one. Okay. So let's just briefly talk about the elephant in the room. The elephant is expensive. The elephant is enormous. The elephant is overwhelming. The elephant is so stressful. And that elephant in the room is the disease of dementia and Alzheimer's. And in California alone, in the year 2020, 65 and older, okay, there was 110,000 people diagnosed. And then the numbers just go up as the ages go up. So for example, altogether between ages of 65 and 85 plus, 690,000 people with dementia. It's the third leading cause of death. And an estimated percentage of change from 2020 to 2025 is 21.7%. More people in California will be diagnosed with dementia or Alzheimer's. In 2020, there was a number of caregivers, over 1 million. Of those caregivers were unpaid, 884,000. That's basically a value of over $18 million. So what that means, family members are taking care of their loved ones. They're not going to their full-time jobs, or maybe they're now working part-time. They're not accruing vacation or paying into their retirement portfolio. It is definitely an impact on the families, not just emotionally and physically, but also financially as well. So let's just kind of talk about the 10 signs of dementia. As I mentioned earlier, difficulty doing familiar tasks, cooking, forgetting how to cook, problems communicating, not finding the right word, not understanding what we say to them, or complex conversations, changes in mood or behavior. You typically in early stages, we see quick to anger, agitation, real frustration. And then also just confusion of time and place, not knowing what time it is, or where they are, or what day of the week it is. And in particular, one sign is how they withdraw. They withdraw from friends, family, tend to just stay inside. It's because they're aware of their memory impairment, and they're embarrassed to be perhaps with their friends, especially if they're very socially active, like in bridge clubs or exercise classes or painting classes. We start to see the things that they once enjoyed doing, they're no longer doing. It's because of that awareness that they feel they can no longer do it. So again, kind of really want to emphasize symptoms of dementia. It can vary greatly. It's not one size fits all. Symptoms may be similar. However, dementia is different with everyone. Again, it affects memory, short-term memory, ability to focus and pay attention, reasoning and judgment. That is a significant sign if you start to see your loved ones spend lots of money or giving money away, or if they are still driving, you start to see where their driving abilities are now compromised, getting lost. Most important, though, is visual perception. The eyesight is one of the first symptoms, and it is also the one that is most overlooked. So when I first meet with families about their loved one and what they're experiencing, I always ask, when was the last time your loved one was seen by their eye doctor? That's one of the first doctors to see. So let's kind of break this down a little bit. Alzheimer's is the most common form of dementia. It affects about 60% of individuals. It is a progressive disease. Again, early signs includes difficulty recalling memories, just an overall decline in mental ability. Okay. There are different types of dementia. There is vascular dementia, which can be brought on by heart disease, stroke, high blood pressure, diabetes. Typically, vascular dementia follows after a person has suffered TIAs, mini strokes, and of course, a major stroke. There is dementia with Lewy bodies dementia. A person with Lewy bodies dementia typically, when from time of diagnosis, typically it progresses very rapidly. Within 3 years, the person possibly passes. With Lewy bodies dementia, they have difficulty sleeping, hallucinations, or they will just fall asleep at the table. They'll be talking 1 minute and the next minute they are asleep at the table. With Lewy bodies, there is, it affects their gait, balance, and there's frontal temporal dementia. Frontal temporal dementia, again, not, affects obviously memory, but also behaviors, socially inappropriate behaviors. Parkinson's is a form of dementia that affects the central nervous system. These are the most common types of dementia. There's also alcohol-related dementia, a person who has had an alcohol related disease all their adult life. Typically it will lead to a form of dementia. So back to visio perception in dementia. As I mentioned, it's one of the most overlooked early symptoms. The person is less sensitive to contrast, less able to detect movement. Their peripheral vision is impaired. They lowered ability to distinguish, between colors, challenges, changing gaze, double vision, depth perception. That's why we see a lot of falls with the disease of dementia and Alzheimer's, and then disorientation. So there are stages of dementia. It's early stage, which is very, mild cognitive impairment. Then there's mild to moderate, moderate to severe, severe to vegetative. Typically, in the mild cognitive impairment, mild dementia stage, we see again short-term memory loss, start to see a decline in being able to do the active daily living activities such as showering, dressing, toileting. In the moderate stage, we start to see more of that, but now perhaps urinary incontinence. Moderate to severe, the disease is now progressing, language is more affected, not able to find the right words, but also the language is scrambled, kind of like lettuce sounding, doesn't make sense, kind of bizarre, urinary and bowel incontinence, and that continues and progresses into the severe stage of the disease. Again, it's not one size fits all, but typically in the moderate to severe, we see again compromise in their gait, more falls, some loss of weight. And then in the vegetative is where, they're no longer walking, non-verbal, but they still have a sense of awareness. And this is something that is very important for all families to really understand, that although your loved one cannot remember your name or what they had for lunch, the long-term memory is still there, and they have a sense of awareness. A person with this disease still has feelings. They still have feelings of sadness, happiness, fearful, all the feelings that we have, they also have. Just that they're unable to express them verbally the way that we are able to. So Alzheimer's disease, is a buildup of harmful proteins in the brain, the death of brain cells and the loss of connections among them. What are the risks? Age, genetics, head injury. So for example, car accidents, football players, boxers, any kind of contact sport. Suspected risks: heart disease, stroke, high blood pressure, lack of physical activity, depression, and diabetes. There are some therapies treat Alzheimer's symptoms, but they do not slow down the progression of the disease. Again, some approaches, of course, exercise, healthy diet, controlling high blood pressure, heart disease, diabetes. That's why it's very important to review your loved one's medications, especially if they've been on a medication for a period of a long time, like high blood pressure or cholesterol meds, to have a certified pharmacist review those medications, because pharmacists know the medications much better than our doctors. Okay. So by having the pharmacist review the medications, he or she will be able to tell you if perhaps that may be causing some changes in your loved one. And then from that report, you go right to your loved one's primary doctor, or whatever doctor prescribed those meds, and explain the changes that are going on with your loved one. Because sometimes, especially if your loved one has been just prescribed a new medication and you see some changes in their behaviors, in their mood, in their memory, it could be medication related. Okay. And then also another approach is cognitive brain training. But that would be for people such for ourselves to keep our brains stimulated, learning something new. You learn something new, you're creating new neurons, you're creating new pathways in your brain. Okay, so a little bit about the early stages. Again, still able to maintain conversations, may drift off topic, not really understanding our humor and sarcasm, missing it, not understanding, repeating themselves, repeating the same question. You might start seeing some falls, some unexplained injuries, some bruising. And again, beginning to not being able to find the correct word. In the middle stages, they cannot stay on topic. They respond directly to questions with little added information. Again, repeating ideas, repeating the same question, talking about past events. And then they start to reduce their vocabulary and start using replacement words. Carrie, is there a question from someone?
Not yet, but actually, I'm looking at our time, and you're giving us such an amazing overview. There's clearly so much information. I want to make sure we do have the time today for people to ask questions.
Perfect.